So I want to show you just how I start out with a client with their neck. I think neck is hugely important to the success of a massage therapist. If you can make someone's neck feel better, it shows a lot of things. It shows trust in the relationship. It also shows that you really know what you're doing, and it builds confidence. So I'm just going to go through how I start out with a client. I'll start here, my hands on the table, and just some gentle pushing, doing some rocking, then moving, and then I'm going to scoop under. I'm going to dig into the table, fulcrum here with my fingers, and then pull out. It should look like this. You see how her chin's going to go up? She's going to go to extension, and then as I get to about C3, I'm going to lift, and she's going to go back into flexion. So under, scoop under, lift up, pull through, get to C4, C3, and flip it. So just tractioning and lifting. So I'm always tractioning. Tractioning is always going to feel good. Flexion, extension, you want to change how much or how little you do that depending on your person's cervical health and if there's any nerve damage or any kind of pinch stuff. I'm going to go from here. I'm just going straight on, and then I'm going to do a little bit to the side. So I'm going to scoop under here. This hand is going to go. These fingertips will go on her right side. I'm going to scoop under here. This hand is going to go under. I'm going to stay on the right side of the spine, but I'm going to stay close to the spine. So my left hand here, I'm going to call this my clinical hand because it's stabilizing her. I'm going to traction. I'm going to flex her. Then my right hand is going to, you can't see it, but my right hand is fulcruming now with my fingertip up. And I'm going to pull through. All the way up to the occiput, all the way up to those capitis muscles. Now I'm going to do the same move, but I'm going to start basically here and drive this way. So I'm going under. My left hand holding her neck is I'm going to spin here. It's going to be a little bit of lateral rotation, but mostly just rolling her out, just lateral roll. So I'm going to start here, traction, roll. And once you get up to that, about C7, right? Right now the meaty part where everyone has the knots, then you want to make sure that you don't bring her to extension. That's going to feel horrible. You want to bring her into flexion even more and pull up and around. So here, have her start at 12 o'clock, nice and straight. I'm going to traction, I'm going to roll, and then flex up. Okay, I can go even further. So my hand's going to come all the way out. My middle finger will be in that medial border of the scapula. And I'm going to traction. Get to C7, start to roll her out, and up into flexion. And then you do the same with the other side. So just a quick little way to start. People love it. It's a great way to comfort people and to get the neck feeling better.